another compound, another chemical that has been found in higher than normal amounts in multiple sclerosis patients, and how this chemical, it's short for MDA, how it is linked with an increase in disability with multiple sclerosis. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And I was diagnosed with multiple sclerosis over 35 years ago. By the grace of God and a lot of work on my part, I learned early on that what I was dealing with was a parasitic infestation. And I was, again, diagnosed 35 years ago, and not much has changed in the MS world. We still don't know what causes multiple sclerosis, and there is no cure. But what I'm trying to share with you in my live events is that we do know what causes multiple sclerosis. And all the evidence that's coming out in science is confirming that MS is an infectious disease caused by a parasitic infestation. And what I'm going to share with you today is more proof, more evidence. Last week, we talked about the high levels of lactic acid or lactate in multiple sclerosis. And today, we're going to be talking about this other chemical, which is called MDA for short. And actually, it's malondialdehyde, that is the chemical name, and it is produced in our body in response to infections, in response to parasites. So more and more evidence. So with multiple sclerosis, there is a change. There's a lot of changes in different types of, in the chemistry, in the biochemistry in the body. So they're finding that certain substances are in higher amounts than they should be. For example, lactic acid, and then uric acid, and this MDA also. And there's other substances too. And so if we can kind of try to look and understand, like, why are these substances here? What are they associated with? That really helps us to go closer and closer to the cause of multiple sclerosis, and then obviously a cure. So again, if you did not see my live masterclass, or my live training, I should say, from last week, make sure to check out last week's video where I talked about that lactic acid can be up to 3 times higher in multiple sclerosis patients, or nearly 3 times higher, and all the implications of that. So with any type of chronic disease, including multiple sclerosis, we know that they are all inflammatory conditions, that inflammation is always present in every chronic disease. And inflammation is the immune system's response to infection. So when the immune system becomes activated, it's trying to save us, it's trying to protect us from infection, we end up with inflammation. Think about it like inflammation is the war. There's a war going on between our immune system and parasites. And when this war is going on, the good guys, the soldiers, our immune system, they have different ways of going after the parasites. So there's certain immune cells, there's also different signaling molecules that they send out, and our immune system really uses oxygen to treat parasites. So they're called reactive oxygen species, and they're really present a lot when we have inflammation, and then we have something called oxidative stress, meaning that we have a lot of these oxygen type, just think of them like little oxygen bombs that our immune system is producing. So some of them could be hydrogen peroxide, so our immune system can produce hydrogen peroxide, also just superoxide ion, and was hydroxyl radical, so OH. So those are 3 examples of these like oxygen type species, or like little bombs that our immune system is using to help clear the infection. And they know that with multiple sclerosis that there's a lot of inflammation and there's a lot of oxidative stress. And this all just by definition is your immune system is fighting infection. So it is the immune system's response to infection present. And it has been shown that when you have this higher level of oxidative stress, then we have this molecule or compound called MDA present in much higher amounts. And it's very toxic. So it's a byproduct of this response to infection. And so they say, well, they're like, we don't know. It's it's oxidative stress, it's mitochondrial dysfunction, but we could use this MDA substance. We can measure it as a biomarker with severity of disease, because if there's more of this MDA, then there is more disability with multiple sclerosis. So this, again, I'm just going to call it MDA, but it is malon dialdehyde. That's what the compound is. And basically, our body produces MDA when it's breaking down fatty acids and, again, using it as part of its system to treat infections. And I don't know if it's in science or in medicine, probably more in science, they use it as a biomarker to measure oxidative stress. So when your immune system is producing more of these oxygen little bombs. And it's really used to monitor disease status. It's not just present in multiple sclerosis, but it's present in other diseases also. It's very toxic to our cells. It's toxic to our DNA. It increases the risk of cancer, which is another infectious disease also. And in one study they measured the blood levels of this substance, MDA, in the blood of MS patients, and they found that the levels were significantly higher in patients that had been diagnosed with multiple sclerosis than in healthy patients. And it was also correlated with disability. So higher MDA levels in the blood and higher disability in MS patients. And again, so like this substance is higher in MS and other diseases, and it is linked to disability, and it is also, of course, found with different infectious conditions. So, for example, with malaria, I found that they were sharing that high increased MDA activity is found in malaria-positive patients, and it would be present in other infections also, but the research is out there, so you can actually do some searches and find, is there high MDA in like some of the different infections that we know are associated with multiple sclerosis. So we know tapeworms are, so is there elevated? I didn't get a chance to go that far with it, but basically your immune system is going to use oxygen to treat a wide number of different types of pathogens, types of parasites that are making us sick. And so this is yet more evidence that multiple sclerosis is an infectious disease where we have inflammation. Our immune system is fighting infection, and our immune system is creating these oxidants where there's oxidative stress, where there's oxygen species. They're reactive. They're like it's one way of our immune system going after these infections. It's not mitochondrial dysfunction. Our mitochondria are not dysfunctioning. It is that it's a war that's out of control, and we need to support our immune system, not to suppress it. And I wanted to share the amazing successes of students. So if MS is caused by infections, which we know it is, and those infections, which I've shared on other previous events, they love sugar, they love glucose. So carbohydrates break down to sugar and glucose. So carbs and sugars, that's their favorite food. They get a lot of their energy through metabolizing glucose and carbs in an anaerobic environment in our body. That's the easiest way for them to get energy. So here we find that with our students, when they're just decreasing their carb intake with the Live Disease-Free diet, they notice significant symptom improvements. They notice less inflammation, less oxidative stress, and a huge number of symptom improvements. So I just wanted to share, every week we have a live Q&A call in our Live Disease-Free program, and it's on Tuesday nights. So I just wanted to share just a couple of successes from our many students in the program, just so that you can understand like how impactful this is. So this first student, she is a beautiful, wonderful lady who has a family, and I don't believe she has MS, but she has a lot of inflammation in her esophagus. So she's really close to using a feeding tube. And so she joined, let's say, 3 weeks ago only. And so inflammation in the esophagus, like getting a lot of spasms. Like with MS, we get spasms in our legs and our calves, but she's getting spasms in her throat, a lot of pain, and also acid reflux. All of those signs or symptoms are signs of different infections. So H. pylori can be one problem. And what's the sad thing is that when we have GERD and we have inflammation in the esophagus and we have acid reflux, then our doctors are like, oh, you've got too much acid. We've got to give you a medication that blocks your acid or decreases your acid, a proton pump inhibitor. And that makes matters worse because then you have less stomach acid and then more parasites can grow there and you digest your food less. So that is like a downhill spiral to early death. And so she found us and she's been working hard, just following the diet. And she is, I don't know if she has quite come off of the proton pump inhibitor, but I'm sure that she has. I haven't got the confirmation from her, but she's like, oh my gosh. But they come off medications when they're ready. I don't tell them to come off. I just give them information. And so she had that information, talked to her doctor, and then they come off. And it's always good to talk to your pharmacist too, to make sure you come off of medications in the right way. Because if you just quit certain medications, you can get really sick. But literally within like a week, she was also already able to start eating a little bit of softer food. Before she started the program, she was literally blending everything and just having small mouthfuls because it was so painful to eat. And she was really like the clock was ticking. Like if she doesn't figure this out, she's going to be on a feeding tube and it just gets worse from there. But she just shared yesterday that she said, I wanted to share with you that I'm making good progress. I am chewing, swallowing every meal. She's also sleeping better. So a lot of us have a lot of insomnia with these infections. And so she's using an over-the-counter sleep aid. And that's really helping her to have more energy. So she's able to start helping out with meals and being able to be more active in getting ready and going to appointments. She said, my POTS symptoms are getting better. And I drove again for the first time in 7 weeks. Our independence is so important, isn't it? So she was able to actually drive for the first time in 7 weeks. And she said, my brain is still quite fuzzy at times, but better than it has been. Sleep is really helping. She said, as I'm starting to feel better, I'm really enjoying all the information in the Live Disease Free program. And I am learning so much. And I'm so thankful that you have put all of this together. So she hasn't even started treating. She's literally just starting to decrease the inflammation, decreasing that oxidative stress from naturally, immune modulation naturally through not feeding those parasites as much. This next student, shout out to him. He's in Europe. He does not speak English. He has friends that are helping him to translate, and he's in our program. He's just like these people that I'm working with are leaders, trailblazers, and forward thinkers. So this student shared, I'm following the Live Disease Free diet carefully. In fact, I'm noticing more and more energy. I don't struggle to get up from my wheelchair, and I can actually stand for a few minutes with support. Even my left arm, which was completely blocked, I can now move it a little. So sometimes like we haven't used our hands or our fingers for years, and then all of a sudden they start to move again. We're able to start moving them again. I sleep really well, at least 8 hours per night, and I'm having bowel movements every day. So those are important things before we start treating. Sleeping well and daily bowel movements. We go through a checklist, but those are two really critical, important things. The next student, and I'm keeping all the names anonymous because these are people that are in the process right now recovering from chronic diseases. So that gentleman has multiple sclerosis. The next person, he does not have MS, but he was getting really scary neurological symptoms, going to doctors, trying to get a diagnosis, didn't want a diagnosis, didn't want to have to deal with this, but he just wasn't getting results. And he really believed he was dealing with parasites, and he's had a tremendous amount of success treating the parasites over a few cycles. He's not totally done. And then two, like sometimes we can go through a loss in our family, right? Which is so devastating. And yet he's gone through that horrible loss and he still is improving, which is amazing because usually if you still have parasites and you haven't treated them well, that kind of stress, that gut-wrenching emotional stress can really, really make things difficult. make our symptoms worse. So he said, I feel a reduction in the burning of my legs, the internal feeling of like an inflammation process that has definitely reduced very dramatically, a dramatic reduction in brain fog. I'm sleeping much deeper, and also maintaining diet with exercise. He's starting to jog again, which is amazing. He's doing well in his school, working, just moving on with his life. Not done treating yet, but he's just totally life-changing with where he's at right now from when he started. And so he said, what I see, all of this is helping me getting to a healthier state to continue treating. And as I have mentioned earlier, my symptoms have really reduced and my legs have also improved. So happy for him. The next student shared successes. I'm happy to report the light bulbs are turning on and I'm beginning to get a sense of the bigger picture of the whole program. I'm having daily bowel movements. I didn't get up last night once to go to the bathroom, so the bladder urgency is way better. I walked 1/2 a mile 3 times in this past week using my wheelie walker. That is a lot for me. And I'm able to use hiking poles on short distances. I haven't done that in over a year. My heart palpitations are gone. So she's just getting ready to treat. She hasn't even started treating yet. And then just a couple more. This next student shared, the past 2 to 3 weeks have been really good. I had 5 nights in a row where I never got up once to go to the bathroom, which is a record. I haven't done that in many years. I feel really good. So he is treating. He is starting to use like parasite drugs and herbs and the oxidizing agent that we talk about. And I was sleeping better with very few heart arrhythmias. So he had terrible racing heart arrhythmia. And it's really settling down tremendously. Not 100% gone yet, but really tremendously better. And he said, okay, that's good. I've got it all there. So huge for him. And I don't believe he has MS, but just he had a lot of heart issues and other symptoms. This next student is a pharmacist. We have doctors, pharmacists, lots of nurses taking our program. And she shared that she has just completed her 6th treatment cycle and she's on the break week. So we treat and then we take a break. And she said, things are going really well. I haven't had symptoms since I finished my most recent break week. So she finished her 6th treatment cycle and finished the break week and she's still symptom-free, which is so awesome, from multiple sclerosis. And she's had some pretty serious MS symptoms. So I'm going to go to your questions. If you guys have any questions, let me just see here. There we go. Awesome. You're so very welcome for this information. Awesome. Do you guys have any questions about, I guess like the whole point of this, I'm trying to keep it really simple so that it's not a biology lesson, but it's really helping you to see like, I want you to think about this. Why is it that the panel of experts that decide how MS is diagnosed and treated, why are they not interested in the high lactate levels, in the high MDA levels, in all uric acid? Like, why are they just focused on, no, it's just your T cells and your B cells. We've got to reduce them in numbers. We've got to wipe them out. We've got to suppress them. Why are they ignoring all of this? There will come a point in time when they can't ignore it anymore, where there will be more and more research coming out. More of you will be aware of all of this. So there are very strong biochemical changes inside of us. So the parasites themselves can make us sick directly. They also produce poisons that can really impact nerve function and the physiology in our body. They can directly cause damage. They cause our immune system to start this war against them. A lot of times the symptoms that we have are also caused by our immune system's response to these infections. And all of this makes sense. And all of this is in science. It's nothing that I've made up. It's very easy to find in science. It doesn't take days and days and weeks to find this. It's readily, easily available. Doing a quick search, and why are they not interested in this? That is the big question. Why are they not interested in common sense? Like, you guys don't have, many of you don't have a biology degree, but it's just common sense. It's like, well, if inflammation by definition is our immune system's response to infection, maybe we have infections. If oxidative stress is our immune system's way, one of the ways of dealing with these infections, and we have high oxidative stress and these oxygen reactive species, these oxygen little bombs produced by our immune system, higher when we have MS and higher when we're going through a relapse, maybe our immune system is just more active fighting infection. Like, this is common sense stuff. So why? Why are they not interested in this? Is it because go to the McDonald criteria, you can find it online, look on the very back page or two, and look at all the contributors. Who finances the McDonald criteria? It's all the drug companies that are selling the disease-modifying drugs. So I'm not against pharmaceuticals, but is that not a conflict of interest when the people that are selling a product, they get to be influencing the sale of their product? I think that's a huge conflict of interest. And this is the stuff we need to be talking about in different groups, with our practitioners, right? With our, not just doctors, like the neurologists, they're probably not going to listen to you. There are some that are more open. I have an MD right now in my program who has multiple sclerosis. He can't get better with the system, with our standard of care way that we treat multiple sclerosis. So we have to, like, you guys are getting the truth, and you don't have to be a biologist, but I can't get this out by myself. This information is really suppressed. It's really blocked. And so it's going to come from a grassroots effort of people like yourselves hearing about it, talking about it, sharing the truth with other people, getting more and more practitioners. Like, we've had Dr. Lee Merritt, who became aware. She's a neurologist by trade also, and I believe that she is a neurologist. And she's learned about parasites in MS, and she's talking about it like crazy right now. And a big shout out to her. Thank you so much. So we need more and more influential people like her to be sharing the truth. But of course, her talks are being suppressed also. But what's really important is that the only way things are going to change is if we get the word out. So if this is the first time that you've met me, maybe you're just like, parasites? Like, really, Pam? Like, I've never heard of that before. A lot of people have never heard of that before. Watch my masterclass training. It talks about some of the common parasites that are present in multiple sclerosis and other chronic disease. I also share the steps from the Live Disease-Free plan. The basic steps are, number one, we stop feeding the infection so much. And that's where you go low carb and you really notice the parasites are more quiet, and you will notice a lot of symptom improvements. Then we support the body. We want to build ourselves up before we start treating. We want to be feeling better. This allows us to treat more aggressively, to handle it, to avoid Herxheimer reactions. And then when we start treating, we use a systematic approach of treating larger parasites first and then smaller parasites in cycles. So we'll hit them, take a break, hit them again, take a break. And we have to use a layering of therapies. We use parasite drugs, we use oxygen therapies, and we use herbs. The parasite drugs by themselves are not strong enough. Same thing with the herbs or the oxygen therapies. But when you put all of them together with a successful prep phase, the diet and supporting the body, this is why these students are noticing such incredible symptom improvements and recoveries. And that's what you have to do. There's never going to be a one pill, one size fits all pill for multiple sclerosis or any chronic disease. Because as I've shared in previous talks, we're dealing with dysbiosis. Think about your lawn. If your lawn gets out of control, maybe you didn't water it, didn't take care of it, you don't just have one type of weed in your lawn. You have dandelions, you could have thistles, you could have clover, you can have all kinds of different types of weeds. And so they all have to be addressed if you want to have a nice lawn. So if you want to have amazing health, you've got to knock back several different types of parasites in order to feel amazing. And then you can go back to doing the things you love to do. So for me, I could have gotten back into horses years ago, but just work and this work that I do has kind of consumed me. But I'm like, I'm getting older and older, and I'm just like, I've got to get back into it. So for me, horse riding is, and being with horses and being around horses is just my passion. My bigger passion are my grandkids, my family, but a hobby, getting back into hobbies. So you have things that you used to love to do also. Maybe it's some type of sport. Maybe it's traveling. Maybe it's just enjoying nature. Whatever it is, the only way to have the greatest quality of health and the longest and healthiest and happy life, yes, nutrition is important. Yes, activity is important. But the missing link is that you're not correcting your microbiome enough. You're not treating the parasites that are causing your symptoms. So there is no diet that will cure MS, but treating parasites will allow you to recover from multiple sclerosis. So those are the steps. And there's other steps too. We build a healthy lifestyle, those mindset of a wellness champion, learning how to play a real active role, doing most of the work ourselves. That's the cheapest, most cost-effective way to recover. But those are the steps that work amazing. And you have to use a combination. Herbs by themselves will not treat the parasites involved with multiple sclerosis. So I'll see if there's any questions here. So Pam's asking, what causes a cyst on the brain? So a cyst is your immune system, your body's way of containing infection. So it's a little pocket of infection, just like lesions are an area of inflammation and infection. So that's what a cyst is. So if they don't look for parasites or infection in cysts, they just remove them, but that's what it is. And that's a sign that if you have a cyst in your brain, that's a sign that you have infection in your brain. All right. How can I know if I have a parasite? Blanca's asking. So if you have any gut issues, like if you have gas, constipation, diarrhea, any of those symptoms, gas or pain, etc., those are signs that you have parasites. If you have brain fog, any cognitive changes like brain fog, poor memory, depression, anxiety, allergies is another one. And then if you have any type of chronic disease, like any autoimmune disease, they're all infectious diseases. Cancer is an infectious disease. So parasites can cause virtually any symptom in the body. If your microbes are really in balance, you will have a lot of energy. Your heart rate will be perfectly fine. Your blood sugar will be good. I mean, you have to eat healthy too, but if you're eating healthy, your blood sugar will be good. Your blood pressure will be good. Your cholesterol is a sign of inflammation. Your body produces cholesterol to protect you from inflammation, especially in your blood vessels. And so when you eat a lot of carbs, that feeds the infections that cause inflammation in your blood vessels, and then your body produces more cholesterol to protect your blood vessels. And that's known by really good doctors, like look up Dr. Perlmutter and Mercola and all of those wonderful hero doctors. This has been known for many years. They tried to tell us years and years ago that fat caused atherosclerosis and also hardening of the arteries, but it's the sugar, it's the carbs. So if you have virtually any symptom, you have parasites. It could be a nutritional deficiency, but if you live in a country where you have access to good food and you eat a pretty good diet, then it's probably not a deficiency. Although parasites can cause deficiencies. They will use a lot of iron. They can cause extra bleeding, so we can become anemic. They can cause us to become more decreased vitamin D. Vitamin Bs can be decreased. So yes, we can become deficient, but it's usually the parasites that are causing that if you're eating somewhat of a healthy diet. And of course, if you were in a radioactive area, that's another way that you can get disease that would cause symptoms. But most of us have not been in like a really toxic environment where there's chemical spills in our water or high radiation from a nuclear leak or something like that. For the vast majority of us, it's just parasites. So Ryan, your diet helps with inflammation. Yes, tremendously. It is shocking. But the point is that if you don't get into the sweet spot, if you don't get down to the 30 total grams of carbs, you probably won't notice a lot. You might start to notice some symptom improvements, but when you get down to like 30 total grams of carbs, not net, but total, that's fiber, sugar, carbs, starch, everything. It's shocking how much symptom improvements people can have. Some people, all their spasticity is gone. Not everyone, but some people it is. And they're sleeping. One big thing for the diet, the Live Disease-Free diet, is that their bladder is so much better in as little as a week to 2 weeks. As long as you get the carbs down, then within a week's time, you're getting up instead of 6 times a night, you might get up once or twice a night. Huge for the bladder. Then you sleep better. Then you have a more clear mind and you can have more strength, and on it goes. So the diet is the first step. We have the diet guidelines. The Live Disease-Free diet guidelines are on our website, livediseasefree.com. Under research, in the main menu, under research, you'll find them there. And start with the diet. Start to see that you will notice symptom improvements. And again, natural immune modulation. And it's not going to cost you anything other than eating some decent food. You don't have to do all organic. Organic is the best. Local organic is the best, but we don't all have access and we can't all afford organic. But if you try to buy the best quality that you can, but get the carbs down, you'll notice a huge change in your health. And then getting ready to treat and then treating. And if you don't have access to a practitioner that has experience really using the parasite drugs, because our students, they will use 3 to 5, they test well for 3 to 5 parasite drugs. And they don't start with all of them at the same time, but as we have a plan where we're kind of building up to that. Then if you're able to take them all at the same time, then you will find that it's a better killing effect. And then that oxygen therapy is like amazing. And if you want to learn more about that, you can go to our website. Like our blog is amazing. So I've got oxygen therapies and treating parasites. Make sure you watch that. That's really, really important. Go to our blog post and look at all the topics. You will learn so much. I'm so proud of that. And it's free. You can just access it. That is there for you. So with this live event, I will take my notes, condense them down, condense the video, make a blog post. It comes out in our newsletter every week. So I'm constantly helping to bring the truth out, but I need foot soldiers. I need people to help to share this. So please, if you find the information that I'm sharing with you is helpful, please like, share, and subscribe. It does help the algorithms to get this out to more and more people. That's the only way things are going to change. It's going to come from the bottom up, not from the top down. Let's see. Sorry, Kim, I don't see what's on you put something about your MRI. This showed on my MRI on yesterday. I did do a live event talking about MRI with contrast. Please make sure to, if you guys are getting MRIs, make sure to go through that blog post, that video, because the MRI with contrast, the dye that they use, they thought it was safe. They thought that once you had the MRI, that dye would be flushed out of your body. But now they're finding that it's building up in the brain. It's a very toxic metal. It is not safe. And from what I've heard from neurologists is that it's really hardly ever necessary. Like for the vast majority of times, they don't need it. They might do it out of convenience, out of interest, but it's not in your best interest, in my humble opinion. I'm not a medical doctor. I can't give medical advice. That is my humble opinion. And some say treating slowly drives them deeper into the body. Is that true? Yes. And it's not just if you treat them slowly, is if you use suboptimal treatment doses. So if you're like, there's a lot of people that are on forums and they're using, I'm not going to say the names of them, but certain parasite drugs, and they don't know what they're doing and they're using very minimal doses. So it can drive them in deeper into your tissue, into organs, but also it makes them resistant so that that drug won't work for you in the future. So what we do differently is that we just don't start, like if you test well for 5 parasite drugs, you just can't take them all at one time because it will be just too much for you. So, but we found that maybe 3 of them together, that so many people have taken them and they are tolerated really well, and you've done the prep work and you're feeling a lot better, then you can tolerate those 3 together, right? And we introduce them, one at a time, maybe over a day or two, just to make sure that kind of thing is fine, because you're creeping up on them pretty fast. But you're right. If you just take low doses of parasite drugs and you're just guessing, right? And so you might take, maybe you have tapeworms and you're taking a roundworm medication, and the tapeworm isn't going to like it. It's going to be poisonous to it, but it's not going to be enough to kill it. So it's going to move out of the way, and it could move into your pancreas, and it can move into your liver. It can move into the gallbladder, liver meridian. And so that is the problem. And so that's why you have to have this balance of you want to be in a strategic place where you have really supported your body, so your immune system is going to help, that you tolerate the treatments better. And then we use energy testing because the parasite stool tests don't work. So then you want to know which parasite drugs test the best for you. And then you want to use them as synergistically together at an effective dose while you're using I can't see the name of it, but the oxidizing agent and herbs. But you have to be able to tolerate it, because people don't want to just lay on the couch feeling like they're dying. They want to be able to continue to feel better. So that's what we do in the program, and that's why people have so much success, because it's a very strategic plan. And we have a practitioners area. We've had a ton of healthcare professionals taking it. I share all this information with any healthcare professional. I work with naturopaths and doctors and pharmacists, and I just want this to get out of my hands. I want this to go mainstream, and you guys can help. All right. Once treated, can you reverse the symptoms? If you treat the parasites, your symptoms will resolve. That is what happens, because the parasites are what's causing the symptoms. And when they're gone, you don't have the symptoms. And I can't promise full recovery, but what I can tell you is that when you treat the parasites effectively, you will have more recovery than you ever thought possible. And the sooner you treat, the more recovery you will have, because the longer you wait, the more potential scarring of the myelin or permanent damage to nerves can happen. But what I'd also like to say is that what we've experienced with our students is that there is so much recovery that our students are having that we never even thought was possible. People that have been in a wheelchair for many, many years, maybe after 12 treatment cycles, they're standing up with crutches or with support, and they're able to start, working out very slowly. So it's a very exciting time, but we have to get the truth out. We have to get this mainstream, right? We don't want to suffer with this anymore. All right, I'm going to let you guys go. There's a few more questions, but just type your questions in the question box, and our team, the Live Disease Free team, will answer your questions. And if this is, again, the first time you've met me, make sure to watch my masterclass training, which gives you all the steps that I shared, but in more detail, and a lot of the science behind it, especially the types of infections that are linked with MS and other diseases. A lot of case studies of people that have recovered. We've got a lot of their successes on our website and on YouTube. You can actually hear their voices. I just shared Amy's a couple of weeks ago. Beautiful girl. If you didn't get a chance to listen to her story, we had so much feedback on her story. People just are so inspired by her. She's MS free now, which is amazing. So I've got lots of resources on livediseasefree.com. Make sure to watch my masterclass training. If you need support, make sure to reach out, and you can book a time to chat with me and see if the Live Disease Free plan is a right fit for you. So with that, hope you have a wonderful week. Take care and bye-bye for now.